I'm Dr. Vibhavari Patil. I am a practicing psychiatrist at Aayush Hospital, Kharghar. Every year, 10th of September is celebrated as World Suicide Prevention Day. So, we are here to give you basic information about suicide and how to prevent it. Suicide attempt means a person tries to take his own life but is unsuccessful and survives it. And suicide means it is complete. That means the person attempts to take his own life and dies in that attempt. There are many reasons why a person takes a step to take his own life. The major reasons for suicide attempt is underlying mental illness like depression, anxiety, substance abuse like alcohol dependence or drug dependence, and other mental illnesses like schizophrenia or bipolar disorder. But apart from mental illnesses, severe chronic stress or any other family issues or other psychological problems may also lead to suicidal ideation and attempted suicide. There are many risk factors for suicide. Most important ones are underlying mental illness, also substance abuse, alcohol abuse or other substance abuse. Also, in some cases, there is family history of suicide as well. So, the most important risk factor is mental illnesses. Some researchers say that suicide runs in families, but basically it is not suicide or suicidal ideation which runs in families. Many mental illnesses have a genetic basis. So the underlying mental illness which is causing the suicidal ideation may be genetic, and that is why there is a perception that suicide runs in families. But yes, if there is a history of suicide in a family, then we should be alert about it. There are many warning signs of suicide. In majority cases, there is worsening of a mental illness. If there is a diagnosed mental illness, it is observed that the patient's mental illness worsens. He becomes very depressed, or increased use of substances like alcohol or drugs. Extreme irritability can be there. Impulsive behavior like reckless driving or talking of dying or talking of methods of dying. In some cases, there is also a sort of relief which is observed in patients, that suddenly the patient is very calm because he has made up his mind to end his life. And the patient may appear very much composed. He may say goodbye to his loved ones, reaching out to the friends and family. Also, there is observed that he gives away his possessions or loved things to others. So these are certain warning signs which indicate that the person is contemplating to take his own life. Yes, suicide in many cases is preventable because there is an underlying basis. Suicide basically is a desperate cry for help because the patient is not thinking about any alternatives of ending his life. He is not getting a way out of it. So, in many cases, suicide basically is a desperate cry for help, and there are many indications that the person is going through psychological stress or may be suffering from mental illnesses. And if the person gets timely help, suicide can be prevented. There is a misconception that certain people attempt suicide or try to take their life in order to gain attention from the family members or prove their point or get something in reward for that. But basically, a person who is contemplating to take his life is severely disturbed psychologically, and any attempt, however minor or major it may be, is basically a desperate cry for help, that the person is not able to cope with the situation in his life. It is a misconception that if we talk about suicide to a person or a person who is mentally ill, will cause the patient to take a step ahead and complete the suicide. Basically, talking about suicide doesn't reinforce the behavior. Basically, the patient is asking for someone to listen to him, to listen to his problem. He wants an empathetic ear to help him out. So talking and discussing about suicide may actually prevent it and will reveal that the person is in need of help, and the help may be handy if we talk about suicide positively. The person who is encountering any person, it may be a relative, it may be a friend, a colleague, or even a passing acquaintance, if a person is thinking that the person is attempting suicide or contemplating of ending his life, or he is feeling that he may be in danger. So the most important thing any layman or any person can do is to reach out to that person and ask him what is wrong, because even having an empathetic ear may help that person who is contemplating suicide to open about his problem, and the problem may be discussed and the help can be reached out. Secondly, any person who is encountering somebody who is contemplating suicide, if they want, they can warn the patient's relatives or near and dear ones of that particular person, so that they are on their watch, so that that person's life can be saved. Also, you can take action. Just what can I do, or what big difference will it make? I am not an expert. I am not an expert in suicide. You don't need to have all the answers to the questions. You just need to reach ahead and show empathy towards that particular person. That may solve majority of the problems, and in major cases the person will get help that which he needs. Thank you so much for listening. If you are having suicidal ideation or know somebody who is contemplating suicide or has attempted suicide, kindly reach out to the nearest mental health facility or any other help which is available. Thank you.